Okay. So viruses, there are those that infect animals. They can mutate to infect animals. So SARS is the severe acute respiratory syndrome, and that is a coronavirus. It's a type of coronavirus, but it's not as severe as what we've been dealing with now. The West Nile virus, WNV, that is from mosquitoes. It's been a while since we had a West Nile case, but it's deadly, or it can be deadly. So it was. I remember, because it's during the summer months, it's hot outside, so people want to go to the beach, park, swimming. But at that time, people were scared because the mosquito outbreak was so bad, and they were carrying this West Nile virus, and people were getting very, very sick. Body chills, fevers, aches, vomiting. I mean, it was really, really bad. Monkeypox, hence the name. If you play with monkeys, you can get sick. Ebola and Marburg. You've heard about Ebola from, I think it was, what, 4 years ago now? I think that the outbreak was better contained by government officials than what we've experienced with the coronavirus now. Because yes, the Ebola virus was very bad, but it wasn't to the point where we had to quarantine or wear masks. And then you have the H5N1 and the H1N1. Those are very, very severe flu strands, but again, they are transmitted by animals that can affect us as humans. Hepatitis B, these are common viruses. So hepatitis B is caused by the HBV, or hepatitis B virus. It is transmitted by blood serum and body secretions, and it affects the liver. The the vaccine is expensive, but it is for your protection. Employers, such as school districts and hospitals, where you may come across or may come in contact with bodily fluids, they have to offer it to you at no cost. So Aldine, every year for our health fair, they offer it to employees if they've never had it. And once you get it, you don't have to get it again. So it's a one-time vaccine. And you're like, well, miss, if you got it, why would you get it again? Or why wouldn't somebody have already got it? Some people don't take vaccines. Some people don't see the importance of it. But at any time, as a teacher, we may be faced with someone with bodily fluid. For example, one year, my one of my students on the bus, she didn't feel well. And she told me, miss, I don't feel good. We were on our way to clinical rotations. And she said, I really, really don't feel good. So I said, okay, I'll turn the bus around. She said, my mom is coming to get me. So we turned around. We came over here in the horseshoe behind Little Nimitz. And before she got off the bus, she vomited everywhere. So that was something that myself and the bus driver were not expecting, but we had to clean it up. So that is why you have to take precaution against yourself and make sure that you have this vaccine, because it is an occupational exposure. I was at work and she could have had anything, but an occupational, exposure to blood or any body secretion. Hold on. Okay, so hepatitis C is caused by the hepatitis C virus. It should be HCV, not HBC. It's hepatitis C virus. So that's a typo. It should be HCV. sure that the other one, yeah. It's transmitted by blood and blood-containing body fluids. Many are infected individuals are asymptomatic, meaning that they do not show signs of their liver being damaged. And one of the symptoms that you see with liver damage is jaundice. Excuse me. And jaundice is where the skin turns a yellow pigment because the body is not filtering or functioning correctly. The liver is to filter waste. And if you've heard the term liver failure, excuse me, the body is no longer being able to filter out what we don't need. And you become septic, meaning your body is then full of infection. So with jaundice, the skin or the sclera, which is the white part of your eyes, turns yellow because that is your body's reaction saying that I'm not filtering correctly, something is wrong. It usually starts with the eyes first and then it will spread to the skin. But if you start spreading to the skin, more than likely you have liver damage or liver failure. And this gentleman right here, he probably is at the end stages of life. Because if his whole face is yellow, that means his whole body is yellow. So hepatitis C is caused by, it did it again. It should be HCV.
I think that's the same one.
The same one? Okay. I want to go to the next. Okay, next slide is this. There we go. Okay, so common viruses continued is the acquired immune deficiency syndrome that you know as AIDS. It is caused by the human immunodeficiency virus known as HIV. This virus suppresses the immune system, meaning that they are not able to fight off infection like you and me because we are healthy individuals. Their T cells or their immunity cells have been affected. Individuals become susceptible to cancers and infections that would not otherwise affect a healthy person. And I ask this question because it's a serious question. How would you treat a person that has HIV? How would you treat them personally? How would you treat them physically? How would you treat a person with HIV? There is no cure and no vaccine for HIV, but there are antiviral medications that help keep the symptoms down and they're not, I don't want to say the symptoms are in remission, but there are better medications available to where it's barely detectable. Now you hear, I don't know if you've heard it, but I've heard it several times, that there are these commercials that say, hey, we beat science and you can't detect HIV.
Mm-hmm.
Just because you can't detect it doesn't mean the person doesn't have it. No. So don't let that fool you. But to answer my own question, how would you treat a patient with HIV? You treat them the same, just like everyone else. Just because HIV, you cannot deny them care. You have to take the same universal precautions that you would with anybody else. Wear your gloves, dispose of needles in the correct fashion, which we will talk about that. And yes, they're people too. In my situation, I had a patient, he was 21 years old, and he was HIV positive. And I asked him, did he mind sharing his story as to what happened? Because he was so young.
Mm-hmm.
And he said, and you make assumptions. I did. I made the assumption, oh, he's young, he had a drug problem, he got in the wrong crowd, that's how he got it.
Mm-hmm.
That's just me thinking in my head. But I was wrong. It was his girlfriend.
Wow.
And he told me, he said, Miss, I thought that she was the love of my life. I thought we were going to be together forever. And he said, I was so hurt. He said, at one point I was very depressed, but I had to realize that it could be worse. I could be dead. So he had a very positive outlook on it. I can't say that for everybody else, but I treated him just like my patient. He was my patient. So I was going to give him the very best care, regardless if he was positive or not. Okay, so we are moving on into, we're still in classes of microorganisms, but this is a different type. These are helminths. These are multicellular parasites, also known as worms or flukes. They're transmitted by eating contaminated food, bitten by insects, infected insects, and when worms enter the skin. Yes, they could definitely enter, especially by the soles of your feet. Even though you think that that's hard, they could still enter in through your skin, and especially any open types of wounds. Oh, I do want to make a point that I forgot to make in the last slide. With HIV, it does not mean that you have AIDS. HIV manifests into AIDS. So someone can be HIV positive, but they don't have AIDS. AIDS is AIDS. HIV is HIV. It's not, oh, I'm HIV positive. Oh, you have AIDS. No. It's one has not manifested into the more serious virus. Okay, so back to these worms. They're fairly nasty looking. And if you've ever heard the term, "ooh, he got worms," that came from people that really do have worms. It's a parasitic infection. These are worms inside someone's intestines. So, what happened was this individual probably was losing weight at a rapid pace. They were always hungry because as soon as they ate it, the worms ate it up. These worms multiply rapidly, and how do you know you have them? Because when you have a bowel movement, where do you think they're trying to exit? Through the anus. So you have to go to the doctor, and this is what happens. They have to go in and remove those worms out of the intestines. This happens, I don't want to say typically, but it's common in third world countries because of the conditions, contaminated food, infected insects. It's common in third world countries. Types of infections. Some pathogens or some diseases. They produce poisons called toxins. This can cause an allergic reaction. They can attach and destroy the living cell that they invade. The one thing that I can tell you is a good example is a spider bite. A spider releases toxins into the skin, and an allergic reaction doesn't necessarily have to be that you can't breathe, but it can be a severe episode of swelling. And if you do not get the affected area treated immediately, it can necrotize, meaning that it will die, that tissue will die, destroying the cells. Okay, so these are vocabulary terms that you will need to be familiar with. Endogenous, this is where diseases originate within the body. So you have metabolic disorders such as diabetes. That is a metabolic disorder. Your body is not processing sugar correctly. Tumors, that you know as cancer. And congenital abnormalities, meaning that you have been born with this condition and it may or not be able to be fixed. One is when you are born with a small birth defect in the heart. It's typically a small hole in the heart that impedes blood flow, but it's caught by the time the baby is born, and they have surgery, I think, when they're about 6 to 9 months years old. Or a hernia. That can also be considered a congenital abnormality because the baby should not be born with the intestines outside of the skin. So they have to have surgery to put it back. Exogenous is the disease originates outside of the body. So pathogens, this all the things that we talked about. Trauma, so any type of horrendous or severe accident, and temperature extremes, heat stroke, frostbite. Continuing with the types of infection, you have nosocomial infections. These are hospital acquired or healthcare associated infections, which is abbreviated as HAI. And what that means is that you go into the hospital with something, but you come out with something else. And I know that this really unfortunate and it's not something that you want to happen. But let's say you go to the hospital and you have pneumonia. But then you come out because you've been infected with MRSA. Well, that is a nosocomial infection. You received it from a healthcare facility. And with me saying MRSA, methicillin resistant Staphylococcus aureus, that's the Staphylococcus or Pseudomonas, which is another bacterial infection. Opportunistic is when the body's defenses are weak. And an example is Kaposi sarcoma, which is a type of cancer. And those those conditions are usually people who have an immune compromised system. Their system is immunocompromised. So patients that have AIDS, patients that have cancer, patients that have an autoimmune disease, so multiple sclerosis, Lou Gehrig's disease, scleroderma, Sjogren's. There are several autoimmune diseases where the body is already attacking itself, but if you have another condition that is more severe, then your body has a very hard time fighting it off. Here's a picture of Kaposi sarcoma. Alright, so the chain of infection is present for disease to occur and spread from one individual to another. You have an infectious agent, which is the common pathogen. So of course I'm going to refer to the coronavirus several times because that's what we're dealing with now. So reservoir, is a place where the causative agent can live. Coronavirus, tuberculosis, uh, strep throat. The portal of exit is the way for the causative agent to escape from the reservoir. So a reservoir, a place where a positive agent can live. So with a reservoir, some examples would be the human body, animals, the environment, or fomites. And a fomite is an object. And fomite is spelled Fomite. Fomite. A fomite is nothing but an object. So a desk, a phone, a computer mouse is a fomite. A portal of exit is a way for the causative agent to escape from the reservoir. And those exits would be urine, feces, saliva, blood, tears, mucus discharge, sexual secretions, and draining wounds. So modes of transmission, you have direct contact, which is usually person to person, and indirect contact, where it's transmitted by food, air, soil, insects, pretty much anything in the environment. Indirect is not person to person. So the portal of entry, what systems can be affected? All of them. Your respiratory, your digestive, your reproductive, everything can be affected. So the portal of entry is how it comes into the body. Similar to portal of exit, but portal of entry, your body has some defenses where it could stop or prevent those bacteria from coming in. So with a mucous membrane, they line most of your hollow tracts. So your reproductive, your digestive, your reproductive organs. They, I said respiratory. I said reproductive tract. It's respiratory, digestive, and reproductive tracts. It will trap the pathogen and expel it. Cilia, you have tiny little hairs that are inside your nose and inside the respiratory tract. That's going to help push out dust and other germs. Coughing and sneezing, that is a defense mechanism. You're trying to either cough it up or because you smell something or something is around your nose, you sneeze it out. Hydrochloric acid is in your stomach, and that's going to destroy any pathogen in your stomach. Tears in the eye, it's not always for when you're sad, but it also helps combat anything that gets in your eye, your eye waters up. That is a defense mechanism. A fever. A high temperature destroys some pathogens because sometimes people are so quick to, oh, let me go take something for my fever. No, we want to let it break because then we know that the body has done its job. But if it becomes too long, so if you've had a fever for over 101 for 2 days, that's a long time to have a fever. We only needed to have it for a couple of hours, let it break. Infection. I'm sorry, inflammation. Inflammation is leukocytes or white blood cells, and that's destroy pathogen. That's what I told you pus was. Leukocytes,
Mhm.
red blood cells.
Yes.
And then the immune response is that the body produces antibodies. These are protective proteins that help fight off any type of disease, pathogen, or anything that's going to damage your body. A susceptible host is an individual that is likely to get an infection or disease because the body defenses are weak. I've gone over this in the previous slide, which is the body defenses, mucous membranes, cilia, coughing and sneezing, hydrochloric acid in the stomach, tears, fever, the inflammation response, and the immune response. So the chain of infection. We want to eliminate any step in the chain and infection is stopped. Follow practices to interrupt or break the chain. Remember pathogens are everywhere. Transmission is preventable and it is also a continuous process. Again, I will refer to the coronavirus because you understand that and we're in that age right now. So in order to break the chain, we wear the mask in order to stop droplets from traveling in the air. We wash our hands. We use hand sanitizers. We avoid large gatherings, or you should avoid large gatherings. We also practice social distancing in order to prevent the spread of aerosol or air-like droplets from person to person. So those are all steps that we are using to eliminate the infection, the chain of infection. Here are some definitions regarding aseptic techniques. Asepsis is the absence of disease producing microorganisms, meaning that it is clean, wiped dry of any germ. Sterile is free from all organisms. Now, when you go to, if you look at a band aid is sterile because it's in a packaging, it hasn't been exposed to the outside air. The same with gauze. Gauze is individually packaged. Once you open the package, it is then considered contaminated. Any object or area that may contain pathogens. So if you open gauze, lay it on the counter, well, it's then contaminated and you can no longer use it. Aseptic techniques include hand washing, good personal hygiene, use of disposable gloves, which should be disposed of in the trash when you are have been when you're done with them, not like you see in the parking lot at the grocery store, thrown on the floor because someone else has to pick up that contaminated object or contaminated gloves. So put them in the trash when you're finished. Properly cleaning instruments and equipment and thorough cleaning of environment. Antisepsis. Antisepsis is to prevent or inhibit growth of pathogens. This can usually be on the skin. Antisepsis are not preventable of spores and viruses, but the example that can be used on the skin is alcohol and betadine. Disinfectant or disinfection is a process that uses chemical disinfectants to destroy or kill pathogen organisms. Again, it's not effective. Excuse the bell, guys. It's not effective or always effective against spores or viruses, but disinfectants that you know that are used mainly on objects is bleach. Sterilization destroys all microorganisms, including spores and viruses. It's the use of steam under pressure, gas, radiation, or chemicals on an object. Ladies, for those of you who go to the nail shop and you see that nice little packaging that they take out to clean your nails or do some type of aesthetic procedure on you, those tools have been sterilized. They've been steamed to perfection to be clean for individual use. There's a little oven that you see in there that's called an autoclave. And they put the tools in there to be sterilized again, cleaned to perfection to be used from person to person.